Hello, healthy people. A few days ago, a new study came out discussing how an artificial sweetener called erythritol may dramatically increase the chances of a heart attack or a stroke, so I thought I would go through the evidence. This is the front page of the study, and there are a couple of things to note. The study is in a very reputable journal. The statistics and numerical analysis are impressive, meaning that there's only one chance in 10,000 that this increase is just due to random chance, and the effect size is large, meaning that it could double a person's risk of an adverse event. The study divided patients into 4 groups of quartiles, which is what the Q is referring to. The y-axis is survival. So as you can see, those who used a lot of erythritol had a significant decrease in survival. Taking a look at the patient population, they were mostly over 65. They were predominantly male. They were a little bit overweight, and normal BMIs up to 25. And these were more like 30. 20% had diabetes, 70% had hypertension, over 12% were current smokers, and about 3/4 had known coronary artery disease. So they were already an at-risk population, which means they were exactly the sort of people who might be tempted to use an artificial sweetener to decrease their cardiac risks. Artificial sweeteners are currently a $9 billion industry, so there are a few of them, as this table shows. This study was mainly on erythritol, but also included other polyol sweeteners, which are shown mainly in the bottom 3 rows of this table. Here's a more close-up view, and it shows the trade names that you may want to try and avoid. These alcohol sugars appear to cause increased non-fatal heart attacks, increased fatal heart attacks, and increased strokes. The mechanism seems to be that they make platelets clump together. The large circles in the diagram are red blood cells, and the smaller, rounder cells are the platelets. Clumps of platelets block arteries and cause heart attacks and strokes. ASA and other antiplatelet drugs decrease heart attacks and strokes by preventing this clumping, so the polyol sweeteners seem to oppose the effects of aspirin and many other cardiac drugs. A couple of things to keep in mind are that this is only one study and it may be completely wrong, although that's not super likely, but we should watch for follow-up studies. And in the meantime, it might be prudent to avoid polyol artificial sweeteners. And a healthy and happy good day to you all.